Hi, this is Dr. Carolyn Coker-Ross, bringing you the Inclusive Minds podcast. This podcast was inspired by the book of which I'm a co-editor entitled Anti-Blackness and the Stories of Authentic Allies, Lived Experiences in the Fight Against Institutionalized Racism. If you're a psychologist, a social worker, an addiction professional, or a healthcare provider, or anyone who wants to broaden your horizons, then this podcast is for you. The goal of the podcast is to help you understand some of the more complex issues facing our culture today. My guests are experts in their fields, and we'll be talking about a wide array of topics, including cross-cultural issues, the intersection of race and trauma, social justice, and health inequities. They will be sharing both their lived experiences and their expert opinions. The goal is to give you a felt experience and to let you know that you're not alone in being confused by these complex issues. We want to provide nuanced information with context that will enable you to make your own decisions about these important topics. Hi, everyone, and welcome to the Inclusive Minds podcast. I have a wonderful special guest today who is an author of the book. Janelle, you want to hold up the book? Which I'm a co-editor of, Anti-Blackness and the Stories of Authentic Allies. So her chapter is fascinating, and I really was excited to have her on the show today. So let me tell you a little bit about Janelle. Janelle Johnson is a licensed marriage and family therapist. She's a wife, mother, and the founder of Bridges Family Life Center, a neurodiversity clinic and consulting practice in North Carolina. She is an award-winning educator and disability advocate with lived experience. She is also the first Black president of the North Carolina Association of Marriage and Family Therapy. Mrs. Johnson is now a doctoral candidate at North Carolina State University, where she researches advocacy interventions for caregivers of Black autistic students, as well as approaches to institutional policy change that center BIPOC neurodivergent experiences. Janelle provides tailored equity and inclusion training, consulting, and speaking internationally. In her free time, you'll find her doing what I love to do, eating delicious food, hiking with her family, and watching K-dramas. Does everybody know what K-dramas are? Because I had to look it up. Is it a popular term?
Korean dramas.
Yeah.
Most people know what Squid Game is.
Oh, yes. We all know Squid Game.
Squid Game is about the most popular K-drama right now.
Yeah, and it came back not too long ago with the sequel, right?
Mm-hmm.
Okay, so let's get into your chapter. In your chapter, you write about your advocacy work around disability. So tell us a little bit about what your story is and how does your lived experience challenge kind of commonly held assumptions about disability in the Black community?
Sure. Well, first of all, thank you. Thank you for having me. I'm glad to talk with you all about this. Loved writing this book chapter. My lived experience kind of drives all the work that I do. And when you're a multiply marginalized person, someone that has multiple forms of neurodivergence and multiple forms of disability, that means that a lot of things impact you. And so that's why my fingers are in a little bit of everything.
Can I ask you, for people who aren't clear about what you mean when you say neurodivergence? Because it's a fairly new term.
Sure. So neurodivergence is a term that was coined by an activist named Cassian Asasimasu. And they defined it as a brain that significantly diverges from what is typical, socially acceptable. That's all. So it's a very broad. Sure. It's a very broad term. The alignment with the term and the way that we have defined diagnoses in mental health and in healthcare You usually see alignment with an umbrella of diagnoses like autism, ADHD, dyslexia, but even other things that people don't think about that are part of the neurodivergent umbrella, like OCD, PTSD, um, and even some neurological physical conditions like cerebral palsy.
Okay. So it's the neurodivergence is an umbrella term that includes a lot of different diagnoses then.
Definitely. It is meant to be a community building term.
Hmm. What
Yep.
does that mean? How does it build community? Are you saying it gathers everybody under one tent? Is that basically it? Okay.
Exactly. Gathering folks that have a similar experience so that they can be strengthened and empowered in community together.
Okay. So how does your lived experience then challenge what normally people think of about disability in the Black community?
Sure. So, in the Black community, these words, just like you're saying right now, a lot of these words and terms are very new. They're new to the public in general. But particularly in the Black community, a lot of folks are just hearing or just learning the word neurodiversity or neurodivergence for the first time. They're just learning about autism, that it exists, and that Black people have it, and Black people are autistic. So um, I think the challenge is we develop our understanding of um of an experience based on what we're exposed to, and most people have they're exposed to neurodivergence. I'll speak specifically about autism, because that's like the thing that we have the most research on and understanding of. Um, Most people have an understanding of autism that's based on what they see in the media. So they're thinking of everything from um, Sheldon to um, Rain Man, like these um, extremely different representations of um, what autism is. And in the media, you don't see representations of Black autistic people, Black ADHDers, Black folks that have neurodivergent condition. We're starting to see more folks who are coming out as autistic that are adults. They're securing diagnoses later in life. That's definitely my story. I self-diagnosed when in 2017, and my story is very unique because I'm a therapist, right? So I actually can diagnose autism and do diagnose autism. And so I was sitting across from a Black man, and he was textbook, but not textbook at the same time. And I knew after the first 30 or 40 minutes with him that I was going to provide a preliminary autism diagnosis. But I also knew that I had never had this experience of diagnosing a Black person. I had diagnosed white people before, but not a Black person. And I also knew that what I was looking at was a mirror of myself. And
Yeah.
it was a shock. So I kept myself together for the session, and then I walked outside, got in my car, called my mom crying, like, Mom, how did I not know this? How did I not see this? I'm definitely an autistic human. So that's kind of a story about my initial diagnosis before I got one from a therapist.
Well, you mentioned though that you diagnosed autism in non-BIPOC people, white people. What's the difference though? Like, why was this so different for you?
Sure. So I think it's more so the representation of how the symptoms appear.
That's what I'm asking about. Like, what are some of the symptoms that might show up in a Black person that would be different in someone else who's not Black?
Good question. So, for one, for what I have seen in Black clients specifically is the way that stimming happens. Stimming is repetitive behavior that
How do
that
you
a
do, right?
person likes calming. Yeah. So rocking, flapping hands. But everyone stims, right? We like bounce our leg when we're a little bit nervous. That's a stim. Um, so for Black people, I found that some of the repetitive behavior is culturally influenced. So I've had clients who they um, they can't get a beat out of their head, and they repeat the beat repeatedly. They might beatbox a lot, or sing the rhythm over and over again. And that's and it ends up being a representation of the stem that is culturally relevant, and so we overlook it. But the way that the person is using it, it's actually a stem. It's actually a culturally influenced representation of a symptom. So that's one example.
They're using it to calm themselves.
Mm-hmm.
Okay.
Yep.
Yeah. Because for most people, I mean, another term for that is the earworm. For most people, having that in your head is kind of disturbing and annoying and anxiety provoking. But for people with autism, it may be calming then.
Yes.
Give me one other symptom that you see in your Black patients with autism.
Well, I diagnose a lot of Black adults. And so something that I notice in Black adults that's very common um, for folks that are managing autism is they have a long history of various mental health diagnoses that are actually rooted in a neurodivergent condition like autism, but everyone's overlooked it. And so they have a list like they'll have an autoimmune disorder, they'll have diabetes, they'll have a a diagnosis of depression or anxiety or PTSD, bipolar. It'll be this long list, like 10 different things. And so typically for Black people, and this is all an issue that happens with all Black folks, we are overdiagnosed or underdiagnosed.
Yeah.
It's very rare that we're, kind of on point.
Appropriately diagnosed.
Yeah, appropriately, right? So for neurodivergent folks, though, if all of those things are actually relevant and the client can actually point to, like, yes, this is showing up in my life, then I point to, like, is there an underlying neurodivergent condition? Is this autism possibly? Because typically autistic folks have higher co-occurrence of all kinds of things. And so most of that I just listed.
Most of the things you mentioned are in the literature and the research also associated with childhood trauma, which is, as you know, very high in Black children. So how does autism fit in with the history of trauma? Is autism more likely to occur with? Okay.
Yes, definitely. Autistic folks are significantly more likely to experience traumatic events like abuse, for instance. But also they're a lot more likely to experience like, for instance, sensory issues. If they have a sensory issue that turns into a traumatic event for them, that might not present as PTSD for somebody else, but it presents as PTSD for them because of the way
you have to clarify sensory event, because that is that is psychology speak.
No problem. A sensory event. So a lot of autistic people are sensory seeking. They're seeking out ways to calm themselves or experience enjoyment through their senses. So they might chew on things. They might need to bounce and jump a lot, like different things like that. Other autistic folks may be sensory avoidant. So loud noises are problematic. Bright lights are problematic. It kind of depends, right? So for some folks, autistic folks, we might have a sensory event that causes us trauma. I'll give you an example. So let's say someone a child is in a classroom that's loud.
Yes.
And so they start refusing to go to school, avoiding school. And so for us, it's like, hey, why aren't you going to school? Like, it's not a big deal. Everybody else can handle the loud noises. But for them, they're experiencing a sense of intense discomfort all the way to panic internally when they have that sensory event in that classroom where someone just randomly blurts out a loud noise and they're not prepared for it. To the point where they start avoiding school.
Yeah, I see. How does it help them to get a diagnosis of autism?
It helps us. It helps to get an autism diagnosis for several reasons. One, um, well, I'll say this. It usually helps. I need to clarify that. It usually helps to have a diagnosis. So it helps because one, there are so many services that are available that you will not qualify for. You can't get access to without the diagnosis.
Yeah.
If you are seeking accommodations at school or at work, you can't get those with
Okay.
no evidence.
Yeah.
Right. Right.
Okay, that makes sense.
So that's huge. Two, different types of care that is available, medical care, health care that is available, is covered by insurance, but it's not covered by insurance if you don't have a diagnosis.
Okay, point taken. Well, let's move on a little bit because I have a lot more questions for you. In your chapter, you mentioned that ableism and racism are the quote unquote wonder twins of systemic oppression. First of all,
Yeah.
that is a wonderful phrase. I'm jealous. I didn't think of it myself, but tell us exactly what does it mean, the wonder twins of systemic oppression?
Sure. Racism is a lot newer, is more recent, a more recent development in human history than ableism is. So ableism, we have evidence of ableism in ancient Greece. If you think about if you think about the Spartan community, they had laws that required that babies were inspected when they were born.
Okay.
And when they were born, if they had any defect, they had to be discarded. Right.
Okay. Yeah.
So this is ancient Greece
Mhm.
where we have documentation of that. So race had not been created yet.
Yeah. Right.
Race wasn't created until much later. I think race is maybe like 600 years old or something like that.
Yeah.
So when there's a wonderful book called Racecraft. I highly recommend it if you want to understand the foundation of race. But when race was being created, the concept of race, they used um, they used ableism to create race.
Yes.
Evidence that as evidence that race was something that needed to be created and used to keep Black folks down, Africans down. So Black people, Africans have lower IQ. Africans need to be supported because they are not able to do this, thus and so. It was very much embedded in this idea that um, um, because they're not able,
Or the inferior race.
because they are inferior.
Yeah. So that I just never thought of that as ableism. That's really profound in a way. And I know that it was all of those myths were created to keep people enslaved, for
Right.
sure, and perpetrated a lot of the tenets of white supremacy.
Right.
But to compare it to ableism, it's really I found that very interesting. So I appreciate that. That's great. Okay, well let me ask you something else. Um, in your chapter, you mentioned that the American Disabilities Act was finalized in 1990 and was the culmination of about 25 years of activism. Now, obviously, I lived through those 25 years, and I remember how difficult it was to get people on board to understand how important things like having handicap parking and so on were. But you talk about, again, the tent being a lot bigger, that the ADA also covers a wide array of disabilities like cancer, diabetes, HIV, autism, cerebral palsy, and deafness. Can you say more about the importance of this act?
Oh man. This is really relevant for me in particular because even today, right now, after this call, I'm going to get on a call um, about disabled activists and advocates gathering to support Section 504 not being abolished. Right now, Section 504 is at risk of being abolished in a court case, Texas versus Vaquera. That's what's happening right now.
That is Section 504.
Section 504 is the first piece of civil rights legislation that gave disabled folks rights. And it speaks to not having...
I want to stop you just a minute. And you said that it's the first piece of civil rights legislation. Because again, most people think of civil rights legislation as relating to race, relating to people getting rights. But the Disability Act was part of civil rights legislation. That's very important.
Very much so. Another hit to the idea that racism and ableism are wonder twins. And so
yes,
as such, the work to dismantle them is in tandem.
Yeah.
So Section 504 was actually put into law, but then not implemented. And so the longest occupation of a federal building in a protest was done by the disabled community. They were in protest for 3 days. No food, no water. They cut off the lights, everything. They cut off all access to the building. They stayed there for 3 days. The Black Panthers actually were involved. They brought the activists food.
So they were protesting what?
They were protesting the implementation of Section 504. So Section 504 meant that that folks that received organizations, government, schools, healthcare providers, anyone that received federal funds had to make sure that their services were accessible, that they were not discriminating against disabled people.
Which would mean that schools and other public places would not be handicapped accessible.
They would not be required to be, right. It would be. Yep, it would, once again, it would no longer be illegal to discriminate against disabled folks if you were a receiver of federal funds.
Shocking. Yeah.
As a person that is disabled, but I'm also raising a disabled child who has higher support needs than I do, these things are really relevant.
Wow. Okay. Well, I was surprised to learn in your chapter that Harriet Tubman, who most people know because there was a movie, at least, that she also was disabled, that she had seizures and chronic pain and narcolepsy, and she was also a radical disability activist. That was so interesting to find out. So, yeah, I mean, it seems like, race is often at the forefront because that's the first thing people notice in most Black people or people of color. But disability isn't always that visible.
Right. And
Like you said,
understandably so. At my practice, Bridges Family Life Center, we've been there for about 7.5 years. But the time that I created 3A, we had been open for about 2.5 years. And I noticed that I was seeing the same pattern. So I would say about 60 to 70% of our clients are Black and brown. It's the majority of who we see. And there was this dynamic that was happening in families, particularly among heterosexual couples, that the division of labor was causing challenges. And really, this is a issue of often in Black families. What I saw was this was an issue of patriarchy and gender divide, right? So I created 3A to help couples be able to first repair. There was so much disagreement, so much hurt, so much pain that had happened amongst the couple for however many months or years before they came. And they were trying to just gloss over it and move on. And I'm like, you got to actually fix it. You got to repair your relationship before you can come together and begin to come up with a solution that works for your family. So that's why I created 3A. Acknowledge that something is going on. Ask if you're the person that was the offender. Ask the person that was offended, hey, what can I do different? How can I do this better? How can I fix this? And then act. Make sure that you do that thing. If someone asks you, hey, I really need you to support me in this way, and then you don't do it, how is that going to help the relationship repair?
Yeah. Wow. There was just
Wow.
recently on I think NPR where the the leader of Turkey was concerned about the low birth rate. Did you hear that story? And how they
Mhm.
were saying that women were I think the birth rate was 1.5 children, and so their birth rate is dropping. And they went out and talked to these Turkish women, and the number one thing they said was, I have to do everything. You know, I have to clean, I have to cook, I have to go to work, I have to take care of the kids, and my husband doesn't do anything. Why would I want to bring in, have two more kids and
Yeah.
have to do even more? So that's was another ramification of what you're talking about. But does the
Yes.
3A framework have a specific benefit to Black disabled clients?
Yes. So the framework, I later expanded it about 2 years later. I expanded it
Mm.
using using a theory that's prevalent for Black disabled folks called discrit. And so the reason I expanded it was because I wanted to center on the concept of intersectionality and power. That there are considerations that we need to make clear that exist in society, that men have more power than women in general, that um, that um, that white people in general tend to have more power than Black and brown people, um, that straight people tend to have more
Yeah.
power than LGBTQ plus folks. Like there's these power dynamics that exist. And so when we're trying to repair, if we ignore the power dynamics, that we still don't repair.
Yeah.
And so
Of so give us an example of how you would use 3A in that.
sure. So in the book, I talked about my experience with a client. Um, and the client came in. This was a Black woman. The client came in with a history of abuse, sexual assault,
Okay.
and so she was there because her employer um, was firing her because she refused to go to work because a colleague had assaulted her physically,
Wow.
and she refused to go back to work with this colleague. And so they ended up firing her. But what they didn't know was that she had this assault history, sexual assault that had happened with the same job.
Oh.
Sexual assault had happened at the same job. She had been with this organization for many years.
Mhm.
So um, when we met, um, our interactions were interesting because she was very hesitant to go to therapy. Um, didn't didn't know whether she should be there or not, but also she was in this situation and didn't know what else to do. Um, and she she and I had a couple of run-ins because um, she was uneasy, and also because I presented myself in a way where I was like super professional and
Yeah.
in the traditional sense,
Mm.
and a little distant and a little standoffish, and that wasn't working for her and what she needed.
Yeah.
So we used 3A multiple times. I used 3A multiple times when we had disagreements. There was one time where she said that she wanted to, um, she was going to pursue suing her employer, and this was a federal government employer.
Yeah.
And I was hesitant. I'm like, "Are you sure you want to do that? I don't know if that's a good idea. Like, you got kids and you're on the border of homelessness."
Mm.
And it didn't go well. We had to have a discussion, right? And
Yeah.
so I ended up the next session. I came back and I used the A. I acknowledged like, "Hey, I know that our last discussion didn't go really well, and how can we address this together?" And That's the ask part. How can we address this together? What could I do differently? What is it that you need from me?
Mhm.
And she answered those questions, and I did it. So I just went, and she said that she wanted me to just go with what she wanted to do, and she didn't want pushback. And I said, fine, let's go with it. This lady ended up being homeless,
Mm.
and all of that. And I just went with it. I just said, I believe you. I'm going to support you. She had some major health issues, had to have major surgery. It was a lot.
Yeah.
But she ended up coming out of it and won the court case. Yep, won the court case. We worked together for 2 years. Um, and I was glad that we were able to still work together and continue to repair, because she needed someone that could support her.
Yeah. So, how can healthcare and educational professionals who work with Black disabled people develop more anti-ableist beliefs and practices?
Great question. First, I'll start with what is anti-ableism. So ableism is discrimination against disabled folks, and anti-ableism is movement, action that propels folks to grow in their knowledge of what ableism is and their knowledge and how to dismantle it and to actually make moves and action to do so. So that's what anti-ableism is. So how can someone grow in anti-ableist practices that works with Black and Brown disabled clients? First, the most important thing is developing cultural humility. It's a practice of understanding that you don't know it all, and the way that you were raised or the way that you approach life, um, your cultural influences for how things should be done. That's not the only way, and that nobody has all the right ways, right? So that's number one, is examining the way that other people approach life, other people approach the problems.
So, being culturally curious too.
Yes, exactly.
Mine. Yeah.
Right. And that can be something as simple as my favorite thing, watching media from other cultures.
Yes.
What?
Your
Watching.
Korean movies and shows.
Yes, yes. You learn so much. And that's not the only way that you should learn about other cultures, but that's one of the easiest ways that you can, right? And so that's for one, developing your awareness and your curiosity for other cultures and
But you
developing.
don't see a lot of people in the media who are disabled, though. You don't see a lot of.
It's starting. It's
Yeah.
starting to change a bit. It's starting to change a bit, but you're right. You don't see a whole lot of that. Thankfully, if you, which is the next thing that I'm going to say, is following thought leaders and scholars and content creators who are part of the communities that you're trying to learn about. If you spend time in community with other disabled folks, particularly Black disabled folks, you'll find all kinds of things. Oh my goodness. We are out there talking about all kinds of stuff that people just don't know because they're not a part of the community. So they don't know what's happening, and they don't know that they don't know that there are movies that are being made or shows that are being created about disability that they could be learning from. Documentaries like Crip Camp. Love Crip Camp.
Oh, yes.
Favorites.
Crip Camp. That was awesome. Yeah.
They talk about the 504 sit-in in Crip Camp. So yeah, the another good way is to find thought leaders, scholars, and content creators who are in those areas and learn from them. And then lastly, it is really about being purposeful about forming real relationships with people who are different from you. Do you have any Black disabled friends? Ask yourself that.
Question. Yeah.
Try to find some. Try to fix them. Also, try to
Yourself, someone on the street, and say, "Will you be my friend?"
Well, no, I think a big part of it is disability identity development, right? I've been disabled my whole life. I didn't identify as disabled until 9 years ago.
Yeah.
Dr. Sammy Shop, she has a book called Black Disability Politics. Excellent book. But she talks about her recent disability identity development. So there's a lot of us who are disabled. I would say that my mom is a disabled person, but she doesn't consider herself that, you know? So,
Well, that's what I
part
was
of it is
saying.
explaining that as well.
A lot of the disability people with disability aren't obvious. Like you could be sitting next to somebody. I mean, if they're in a wheelchair, that's obvious. But if they are maybe autistic, it's not so obvious. So I think probably many of us have friends with disabilities who don't consider themselves disabled, like people with ADHD, for example, and anyway, I want to ask you one last question. You've been really great today. And like I said, I loved your chapter. I hope people will get the book and read it because it's wonderful and explains all of these concepts in more depth. But how do you react personally to the resistance and pushback that you get for your work? And that's happening now more and more, because of the change in the political climate.
Sure. Oh man, that's such a great question. Um, First, I allow myself to react. Like it's okay to be sad, and it's okay to be a little bit discouraged for a beat.
How about
It's okay. Yep, it's okay to be angry. All of that. Like let the emotions flow first.
Yeah.
So yes, I allow myself to feel what I feel in the first place. And then after I let myself feel what I feel, I say, this is 3A again. 3A has an internal perspective again. I acknowledge what I feel. And then I ask myself, okay, what do I need?
Yeah.
And what can I do? What do I need for myself? And then what can I do? Part of like decolonized approaches to therapy is empowerment, right? So it's not just about helping someone to feel better by teaching them tools and skills, but it's also about helping them feel and tap into their own empowerment so that the activism or the advocacy gives them strength, right? So I do things like attend meetings that I'm getting ready to attend after this and build community with folks who are trying to understand and advocate for their rights.
And it's a long-term process. I mean, we all need to take the long view in some ways while still being active in the short view. Because I think it's easy to just sit back and say, I can't do anything. And I'm just going to sit on the sidelines and be upset,
Right. But that's not good for our mental health.
It certainly is. And I have a lot of patients that I talk to every day who are very just very upset. They don't know what to do with their feelings, So I think this is helpful, what you're talking about. Is there anything last minute that I didn't cover with you or that you'd like to tell us about before we end the podcast?
I will just end with saying that these topics may seem heavy, and they are. But also, I encourage folks in my work, I encourage folks to embrace and center joy in the things that they do. Real joy. Joy is not dependent on what's happening outside of you or the circumstances. Joy is a choice. It's a decision to pursue pleasure and peace and calm. Things that excite you, things that bring you wonder. It's a decision to do those things on purpose. And that's the stuff that we have to make sure that we always fall back on so that we can do the work for the long haul.
That's very true. Well, thank you so much, Janelle. It's been a pleasure talking to you this morning.
Thank you so much.
Thanks for listening. Please subscribe to the Inclusive Minds podcast so we can let you know when the next great guest comes on. The link to subscribe is in the caption below.